Hello. Wow, so nice to see you all here. So some of the first questions I was asked as an entering PhD student simply started with one word: why? Why do you want a PhD in health services research? Why do you want to focus your work in the Medicaid space? Why are you a passionate advocate for Black maternal health policy? Well, instantly, I thought of one person: my aunt. Born and raised in rural Mississippi, my aunt, my motivation, my second mother, yeah, she was definitely one to be reckoned with. She had this unrelenting passion for life coupled with this no-nonsense attitude. She taught me some of the most important skills in life, like how to go after what you wanted and follow your dreams, and how to stand up for yourself, but to do it in the right way. And she also taught me how to do my hair. But unbeknownst to her, she also taught me the significance of my work and ultimately why my research matters. On the early morning hours of October 29, 2006, I received a call that no one should get. One that would change my life as I knew it. That my aunt, at the premature age of 34, had passed away. Had she passed away because she had complications from her asthma? Had she passed away because she was too far from a healthcare facility in rural Mississippi? Or had she passed away simply because when she arrived at that healthcare facility, the providers felt there was nothing else they could do for her? Well, to me, none of this really mattered, because there was one indisputable fact. My aunt passed away, and she didn't have to. My aunt's death was avoidable. My aunt's death was preventable. It was a preventable death of a Black woman. So Black women in the United States are 3 to 4 times more likely to die before, during, and after childbirth when compared to white persons. They also have a higher probability of pregnancy-related complications, such as preterm birth, such as low birth weight, also pregnancy-induced hypertension. The United States is one of the wealthiest countries globally. But when compared to other industrialized, high-resource countries, the US has one of the highest rates of maternal death. Now, this disparity and also the data surrounding it is not anything new. It's actually a disparity that has persisted for decades. It's a persistent statistic that is not fully explained by some things like social factors, like education or income, where Black women with high incomes have, in terminal degrees, like a PhD, have higher rates of maternal mortality when compared to white women in a similar circumstance. So, as a fifth-year PhD candidate in health services research, my current research agenda considers new and evaluated solutions to address these decades-long health disparities, not for women, for mothers, and also for Black persons. I leverage quantitative health services and also academic methodologies to capture the magnitude of the effects of race, racism, and also social condition. Understanding that they lie at the root of these health inequities and are fundamental causes of the disparities that we see, especially among Black persons. I also assert that racism is a mechanism by which racial categorizations have dire clinical consequences. So my focus in Medicaid is incredibly intentional. Medicaid is a vital source of health coverage for low-income women and a large portion of Black persons. Medicaid supports nearly 40% of births in the US within a given year. So Medicaid has this great potential in order to be utilized as a tool to create strategies and also interventions in order to reduce adverse effects, to improve maternal health outcomes, and also to find solutions for the impact of systemic racism and then also discrimination in our healthcare setting. So, with that, my research philosophy is really quite simple. That one, having the understanding that of public health and healthcare's role within our actual environment. 2, also having an interest in social problems and the disparities and the inequities that exist. And then 3, having the critical thinking skills to assess these complex issues All three of those are directly related and also translate into creating, implementing, and measuring public health policy initiatives that impact communities of need. My long-term research goal is that for health services researchers, health professionals alike, to really appreciate the art of health services research, and also the importance of advancing health equity, especially to serve disadvantaged populations, and also learn the science of conducting meaningful, impactful research that is rooted in scientific discovery. By prioritizing Black maternal health policy, we can move forward to ensure that all women have access to safe and equitable health care during pregnancy and childbirth, regardless of their race and ethnicity. Thank you.